can't talk about facial therapy without talking about psychological therapy, because suffering a facial palsy is really traumatic. Anyone who's been through it, anyone who knows someone who's been through it will know how traumatic it was for them. And I think it's also important to know that how severe your facial palsy is doesn't predict how distressed you'll be. So I've had patients who have had extremely severe facial palsies, but really haven't been very distressed by it at all and are quite happy to just go about their life looking as they do. And I've had patients where their facial palsy has been really, really tiny, but it has absolutely wiped them out and they just can't function in any way at all. They are so distressed by it. And that's okay, that's normal. Severity, how severe your facial palsy is no indicator of how distressed you'll be by it. And that's why we screen all of our patients for psychological distress, and that's absolutely imperative. And every single patient, if they need it, should have access to psychological support, and that needs to be carried out by someone who knows about facial palsy, ideally someone in a specialist facial palsy service. At our service at Queen Victoria Hospital, we have a psychological therapist who works with us within our team with our patients. And there's so many treatments that can help with facial palsy. And it really supports what we're doing with our specialist facial therapy and complements the treatments.